Autism is a developmental disorder that appears in the first 3 years of life. It affects the brain's normal development of social and communication skills. Autism is a physical condition linked to abnormal biology and chemistry in the brain. The exact cause of autism has remained unknown, but it is a very active area of research. Autism is also known as pervasive developmental disorder. Scientists believe that autism is a result of abnormalities located on chromosome 16. Due to much uncertainty about autism, scientists do not know the mode of transmission in which autism does occur, as well as the gene name. People with autism share little in common genetically. Symptoms of autism include delayed or lack of speech, speech in an abnormal tone of voice, ending every sentence as if asking a question, repetitive body movements of arms or their head, impaired social skills. They don't ask for help or make other basic requests. They have a trouble understanding or talking about their feelings. Limited interest in activities or play, little or no eye contact, and unusual attachments to toys or strange objects. The systems that are affected by autism are mainly the brain, which alters how nerve cells and their synapses connect and organize. How this occurs is not well understood though. Autism is 4 times as common found in males than it is found in females. Researchers discovered an autism risk gene on chromosome 17 called CACNA1G that is more common in boys and girls. The gene is partially responsible for regulating the flow of calcium in brain cells. Calcium is very important in transmitting information, and having too much of the mineral may cause the overaccessibility of neutral circuits that we have seen in autism. Also, autism risk genes have been found on the X chromosome. Since girls carry 2 X chromosomes, they have 2 copies of these genes, and one of the genes may not carry the mutation. This may help to protect them against the effects of an X-linked mutation. Although autism does not yet have a treatment or a cure, being consistent with an autistic child, sticking to a schedule, rewarding good behavior, and maintaining a healthy diet helps with autism. People with autism have a normal life expectancy, but many people with autism over the years become depressed, and that may contribute to their life expectancy. Because there is no treatment or cure for autism, patients diagnosed with autism have to carry on their daily life routines. Autism affects 1 in every 150 children born in the United States. The rate of autism is growing at 14% per year around the world. In China, it is growing at a rate of 20% a year. If one identical twin is diagnosed with autism, the other twin has a 90% chance of developing an autistic disorder. There is no blood test, no scan, and no image that can detect autism. Diagnosis relies on behavioral observation and screening. Being a parent of an autistic child definitely requires more work, determination, and patience. Parents definitely are affected as well as their other children. But all in all, children with autism are no different than non-autistic children, in the sense that all children need care, love, and guidance.